Hello everyone, I am Mariah Angela F. Pineda, a student nurse from BS Nursing 2 here in College of Our Lady of Mount Carmel. So the procedure that I am going to perform is infant bath. For assessment, we have to assess for the family's preference and fit bath time into the family's schedule, then also assess for the baby's body temperature prior to bathing. For planning, we have to prepare all the materials needed. So first, bathtub with a warm water, bath blanket, towel or washcloth, the baby's shampoo, cotton balls if needed, and as well as the baby's clothes. So first, we have to perform hand hygiene and observe infection prevention control. So assuming that I have washed my hands thoroughly, wear PPE if indicated. Then, introduce yourself to the client. So, hello ma'am, I am Mariah Pineda, your student nurse. Then, verify the patient's identity. So, ma'am, may I know your name and birthday? How about the baby's name and birthday? Then, explain to the mother or the significant others the procedure and encourage them to participate as appropriate. Then, close the room door and the curtains if possible. So, assuming that we have already closed the curtains and the room door, now prepare the lukewarm water and check the water with our elbow. And it should not be too cold or too hot. Then place the towel and lay it out in a diamond fashion on the tabletop next to the basin. Then have the baby. Then of course, we have to check for the body temperature. Then, we can now remove all of the baby's clothing except the shirt and the diaper. So, we will remove the bonnet of the baby. Then first, we have to wipe the eyes of the baby with a cotton, starting from inner canthus to outer canthus. And we're going to use a new cotton ball on each eye from inner canthus to outer canthus. Then, we're going to dip the washcloth and make a mitt. Then, wash the baby's face with eyes, ears, and neck. Then, dry the areas thoroughly. Then, after that, hold the baby on one arm like a football hold. Then, place it over the bathtub. And then, wet the hair of the baby. Also use washcloth. Then soap one hand. Then wash the head of the baby gently and in a circular motion. Then splash water to rinse off on the baby's head. Then place again the baby to the receiving blanket and dry the baby's head using the corners of the towel. Then place the bonnet on the baby's head. After that, we are now going to remove the clothing of the baby, including the diaper. Then, lift the baby and put it on the bathtub by putting the non-dominant hand and arm around the baby's shoulder, and the other hand will hold the upper arm on the opposite side. Then wet the upper extremities on the front, back, arms, legs. Then, change the position of the baby. So, turn the baby with our dominant hand like this. Then, again, wet the upper extremities, arms, back, legs. Then, with our with our other hand, have the soap. Then, wash the baby and again rinse off. Then return the baby to the previous position and again rinse off. Then support the baby while lifting from the bathtub by placing our hand and arm on around the baby's shoulder, and while cradling the head and neck on our elbow, then grasp the thigh with our other hand, then place the baby again on the receiving blanket. Then dry the baby thoroughly. Then, in cleaning the genitals of the baby, for female baby, we have to separate the labia with a cotton ball that is moist with a water. Then cleanse downward. Then use a new cotton ball on each side. Cleanse downward. Then, for male baby, we have to retract the forescreen. And again, cleanse the glans penis on each side of the scrotum and use a new cotton ball for each side. Then, again, dry the baby. Then put on the baby's clothes. After that, hold the baby in a period of time and then document all of the procedure that was done, as well as the baby's temperature and the time procedure that was done. And that would be all for infant bath.